stigma surrounding women's health for ages. No one talks about the monthly and natural processes that every woman in the world goes through. I believe this is the basis for many women's health issues going mistreated or undiagnosed. Ever since I hit puberty, I had long, heavy, and irregular periods, excess facial hair, was overweight, and had really bad acne. When I was 16, I went to go see an OBGYN. She did an ultrasound and found cysts on my ovaries. She then diagnosed me with polycystic ovarian syndrome, or more commonly known as PCOS. PCOS was first discovered in 1935. Now, 84 years later, and 75% of women with PCOS still go undiagnosed. I will explain what PCOS is, how it affects women's health, and what's being done to treat it. So what is PCOS? Polycystic ovarian syndrome causes enlarged ovaries or cysts on the ovaries and can affect hormones and almost all other facets of a woman's health. According to the CDC, PCOS is one of the most common causes of female infertility, affecting 6 to 12%, or as many as 5 million US women. So what are the symptoms associated with PCOS? The most recognizable symptoms affect menstruation. The Mayo Clinic says women may have irregular, heavy, long, or painful periods, or little to no periods for even 6 months. Your body may not be able to ovulate or releases unviable eggs, which causes infertility. Another symptom associated with PCOS is an excess or imbalance of hormones, including testosterone, estrogen, and androgens. According to the CDC, women also have higher levels of androgens, male hormones that females also have, which can stop eggs from being released and cause irregular periods, acne, thinning scalp hair, excess hair growth on the face and body, acne, oily, or dry skin. Other metabolic issues include an excess of androgen, which causes insulin resistance, which also puts you at risk for type 2 diabetes. My sister was diagnosed with type 2 diabetes when she was in high school. She went and saw another specialist who then diagnosed her with polycystic ovarian syndrome and explained to her that due to the insulin resistance caused by PCOS, that she was misdiagnosed with diabetes. Often your hormone and insulin resistance affects your ability to lose or regulate your weight and can lead to obesity, which is why I have remained the same weight for so many years, no matter how much dieting or exercise I do. Women with PCOS develop many other risk factors such as sleep apnea, heart disease, and stroke due to your body's increased cholesterol levels, diabetes, gestational diabetes, which is diabetes when you're pregnant, endometrial, uterine, and ovarian cancers, depression, and anxiety. Some may be at high risk of developing these now or later in life. Women with polycystic ovarian syndrome may have all, some, or none of these symptoms and still have PCOS. So what is being done to treat it? The most important way to regulate symptoms is self-care. Losing even 10% of your body weight can help significantly reduce symptoms. According to JohnsHopkinsMedicine.org, weight loss improves the insulin resistance associated with PCOS, and for some women may improve the hormone imbalance and infertility. Exercise can also help your body naturally regulate hormones and your periods. Eating a low carb, low sugar, and high fiber diet can also significantly reduce symptoms. This is often the hardest part for women with PCOS. Due to the other metabolic issues, losing weight can be extremely difficult, but there are some other medications that may help. Birth control is the most common, used to treat menstruation, to regulate periods, ovulation, and help with acne. Women may also be prescribed metformin, an anti-diabetes drug, to help reduce their insulin resistance and help your body lower the risk of type 2 diabetes. Dr. Richard S. Legro, a professor at Penn State University, has spent his career specializing in polycystic ovarian syndrome. He says, metformin does lower circulation androgens and improves ovulation rate. Many use it also as a fertility drug. Statin is another medication that helps your body reduce harmful cholesterol that may lead to heart disease. Simple procedures such as electrolysis, which is used for hair removal, can also help with excess facial hair. Obviously, there needs to be more concern put into caring for women with polycystic ovarian syndrome. According to the National Library of Medicine, giving a patient the diagnosis of PCOS makes the patient aware of possible fertility concerns, dysfunctional bleeding, endometrial cancer, obesity, diabetes, dyslipidemia, hypertension, and theoretical increased risk of cardiovascular disease. Since PCOS could be genetic, it may bring awareness to family members and future children. The enormity of health issues surrounding women with PCOS can cause extreme difficulties that greatly affect the quality of life. It is the most common disease among women, and so little people know about it. Polycystic ovarian syndrome is not just something you live with, it's something you deal with for the rest of your life. With no cure and limited treatment options, this disease can affect women, their future and current families. I hope that you now understand what polycystic ovarian syndrome is, how it affects you, your family, or your friends. Being aware of all aspects of your health will enable you to live better, feel better, and be better.